I remember when I was growing up and I saw all the doctors and I said, what is in that white coat? What is it that they have?
First thing you'll see with my top pocket is all the different types of pens I have. I usually keep a highlighter with me of 1 or 2 different types of colors just because it helps keep me nice and organized when I look at my patient list for the day. Same for pens. I try to keep nice and organized by having at least 2 different colored pens. This here is a stylet. I usually bring my iPad on rounds with me. As a medical student, it's very helpful for me to be able to access patient notes, use my stylet for that, access labs that might be updated while we're on rounds. Next thing I have as a student, here you'll see I have a pack of threads. So during my surgery rotation, I carry this packet of threads. That way I could get some practice during downtime learning how to tie knots. So very nifty and helpful to have. Next thing as a student that I always carry around is a copy card. I like to print things if I'm researching different articles on a patient for treatment plans and things like that. I always bring this with me if I need to run to the library. And then a little guide that's important to have in everyone's coat pocket is a little alcohol prep pad. So in between patients, I always take one of these out to get my stethoscope out and give it a good clean in between patients. And then the last thing I like to keep on me is a pen light. So this is a good way to check how reactive pupils are for different patients, and those results will be different for each patient. So it's something we try to use every day on rounds. So my next pocket is my stethoscope. Definitely one of the most important parts of your white coat pockets. My next set of coat pockets, again, just re-emphasizing the habit of always keeping clean. I like to keep hand sanitizer gel in my pocket. Another thing I like to keep in my pocket is what I call my little black book. This is something that I've used for my interactions with patients. I can use it to take down notes for myself. I can use it to write notes if I'm implementing some type of education with my patients in clinic or on the wards. And again, if I see any interesting cases, I'll write notes to myself just so I know I can go home and read about them later on. So my little black book. Next thing I like to keep in my pocket is my Snellen card. So we use this for checking patient acuity as well as comparing for pupil size. I can use my Snellen card to compare the different pupil sizes. So, and it's actually a very important part of our physical exam. Last thing in this pocket is my cell phone. Actually, I use it quite often during rounds in the clinics and on wards, just because of all of the different applications that the iPhone now has available for healthcare professionals. So for example, if I'm looking up a certain type of medication, I have an app on here that will tell me how to dose it, what are the indications for it, what are the contraindications. It's a very quick and easy reference for us while we're out and about seeing our patients. So on my inside pockets, I keep a lot of my tools for my neuro exam. So the first of those is my reflex hammer. So this is my reflex hammer. It's a good way for me to test patients for their reflexes. Next tool is my vibratory sense tool. You can knock it and apply it to bony prominences for patients and test their vibratory sense. And then my third tool for my neuro exam is a tuning fork. So this lets me test patients on different frequencies of sound to see how their hearing is. So my last pocket, I like to keep some snacks. So we're always on the go with medicine. We don't waste any amount of time whatsoever. So if I need to have something on the go, I always am prepared. I usually bring a protein bar and then a little bit of sugar as well.